Hello, welcome back to my channel. Today I'm going to be looking at why America has one of the highest healthcare costs in the world. Before I begin, please consider liking and subscribing, and let's get right into it. Now, growing up and living in America, I've always wondered how comes the healthcare costs are ridiculously high, and one major surgery or procedure can end up bankrupting you. So I'm gonna look at this article. It was from People Keep, and it lists 9 reasons why that's the case in America. So let's get right into it. So the first reason in this article, it's a great article. It states that reason number one: medical providers are paid for quantity and not quality. What does this mean? This means that the more procedures, the more tests they do, the more they get paid. So many medical providers are gonna recommend keep on keep on like going back and back for this checkup, for these procedures. They're gonna keep on prescribing these and these drugs, and that's why it costs so much. It's not about the quality of the service, it's about the quantity. So the more they get you going back and back and back and forth to their office, that's how they earn more. So that's reason number one. So what's the reason number two? Reason number two, according to the article, states that the US population is becoming more unhealthy. Now, this is something that most people living in America do know because it lots of people are not very healthy. Like in this case, it states that 6 out of 10 US adults have at least one chronic disease, such as asthma, heart disease, high blood pressure, or diabetes. And with unhealthy population, 6 out of 10, can you believe that 6 out of 10 people have a chronic illness? And what does this mean? Chronic illness requires a continuous checkup. That means you have to keep going back and back to at least manage the disease. So that's why the costs end up piling up more and more and more because these are long-term healthcare. It's not something that you treat once and then it's done. No, you have to keep going back and back. But majority of American population either have asthma, heart disease, high blood pressure, or diabetes. So that drives the health insurance cost to be higher and higher. So reason number three states that newer healthcare technology is more expensive. So in this case, many organizations, many hospitals rely on upgraded services to do upgraded healthcare technology to test and to do conduct services, and this one also adds up to the cost. Now, it depends really on the hospital. I've been to some hospitals that look like they're back in the past, like in the 90s, but for most big hospitals, they do have advanced healthcare, and the technology aspect of it, the testing and everything drives up the cost according to them. So reason number four states that many Americans do not choose their own healthcare plan. What does this mean? It means that majority of people either get their healthcare insurance from their job. And what do businesses do? They try to minimize costs, so they will look for probably the cheapest insurance provider that they can get to save cost on their end, and they don't really consult their employees, asking them their conditions or whatever, like which health insurance would you rather have. So they will try to cut costs on their end, and they end up picking health insurance that probably does not cover majority of the conditions. So that drives up the healthcare cost to the patient. So this is not a good thing, but it is what business have to do. That's capitalism. So that's reason number 4. Americans don't choose their own healthcare plan. Mostly it's chosen through their employer, and the employer picks the cheapest they can find to lower their cost. Reason number 5 is there is lack of information about medical care and costs. So in this article it states that according to the Milken Institute, only 12% of the U.S. population is health literate. That means that only 12% know exactly what. If you ask someone what does a copay mean or what does deductible, like most people don't know those things. So lack of information is expensive in the end, because if you don't know what's really going in a plan, you're gonna pick probably a wrong plan that does not suit you. So many people don't know the health care terminologies, they're not health care literate, and that ends up driving higher the cost of healthcare. Now, reason number 6 is saying that hospitals and providers are well positioned to demand higher prices. This means that there is partnerships between the healthcare, like insurance and the private healthcare insurance and the actual hospitals have these partnerships. So they're colluding, and this one is gonna obviously impact the patient, because if they have an agreement, the insurer and the hospital, you're gonna end up having to do all these tests and everything, and they're both making a profit in it, and you are left holding, you're the one who has to pay for it one way or another. Now, reason number 7 is the fear of malpractice lawsuits. Now, in this case, it says that majority of the doctors and surgeons, like for example, in this article says that 77% of surgeons have been subject to a lawsuit by a patient. Imagine 77% of surgeons, after they do the surgery, they have been sued. So they've been sued, and in that case now they will try to prevent the lawsuits by recommending all these unnecessary tests and treatments, because they are afraid of the lawsuit. So to cover themselves, they will send you, go test, do this blood work, do this test, all these extra tests that may not necessarily be necessary, but to protect themselves from the lawsuit. In case you decide to sue them, they will have at least proof that they did all these other tests and it's not their fault. So the doctors and surgeons are really afraid of of lawsuits, so they will try to cover themselves, and that all those extra unnecessary tests do pile up and add to the cost. Now, reason number 8, we are number 8 now. Inflation's impacts on the economy. Inflation has hit almost all sectors during COVID time. There were less patients, in terms of regular patients, not the COVID patients. So the regular tests and services that they used to provide were not there. But then once the pandemic stopped, everybody went back to their normal testing and procedures, and now there is a lot of patients and there is shortage of staff. So it's just a mix up of all these things that it's really affecting the healthcare system. So inflation has impacted the healthcare also. So in that case, there's a rise in the healthcare cost. Now, for the ninth and the last reason, according to this article, is the US population is growing older. It states by 2060, nearly 25% of the population will be 65 years or older. The older you are, the more healthcare tests and procedures you'll probably end up needing, because your body is, it's getting older, so you need to do much of the you have to go to the doctor more often compared to a younger person. So the baby boomers are getting older, and that's gonna pile up because to the healthcare costs, because they're gonna need more services, and that's gonna be more expensive. So those are the 9 reasons, according to the article, why healthcare is expensive in the US. Please let me know if you have any other reasons you might know, and I'll see you on the next one. Please consider liking and subscribing.